I'm responding to the proposition that the U.S. federal laws on medical marijuana should be revised to allow patients to use marijuana as a treatment due to its benefits. The advocate explained what marijuana was, informed us of what medical marijuana can do for you, and provided some cases from around the U.S. that benefit his claims. I have taken the opposite side of this argument. The U.S. federal laws on medical marijuana should not be revised. Medical marijuana has not been tested as much as other medical treatments have. Therefore, my claim is that medical marijuana should not be legal. This is true for 3 reasons. Medical marijuana is no better for you than any other type of marijuana. It has not been studied enough to be a plausible healing substance, and it offsets the patient's state of mind. My first claim is that the federal law states that medical marijuana is no better for you than any other type of marijuana. Through the Controlled Substances Act, the federal government does not recognize the difference between medical marijuana as a recreational use, or medical as a recreational use of marijuana. The U.S. treats medical marijuana like every other controlled substance. Federal law states that it's highly addictive and has no medical value. Second, marijuana has not been studied enough to be a plausible healing substance. The majority of the studies are on how people online are about how people use and like marijuana, not what the definite effects are in medical terms. Marijuana and morphine, for example, have the same goal: to make the pain as painless as possible. Since they have the same goals, patients should just be given a dose of morphine daily. Marijuana is given out to larger quantities of people than morphine, according to a website. Being the drug that it is, there is a larger chance of a patient becoming addicted to marijuana than to the morphine treatment. Third, marijuana offsets a patient's state of mind. The Medical Marijuana Buyers Club says that things which do not normally seem funny become quite amusing when they use marijuana. Their suggestion is to schedule your time around the effects of marijuana. Professor Earlywind, PhD, says that it is not possible to determine the outcome of marijuana on patients, and it can become harmful to the patient. To restate my claim, medical marijuana should be illegal for 3 reasons. Medical marijuana is no better for you than any other type of marijuana. It has not been studied enough to be a plausible healing substance, and it offsets a patient's state of mind. It does not matter how many different treatments an injured or ill person tries to find. The fact is that marijuana, though used as a medical treatment, is still a drug. In the long run, marijuana does not affect your state of mind, but it creates a shorter lifespan. Medical marijuana is a bad idea and should not be used for medical treatment.
Now, Sarah, you basically have developed the counterclaim. This would be like the pro-con sort of speech. Here are the alternative claims, because there's not a lot of analysis of what the advocate's grounds or warrant were. Now, your counterclaim is applicable, for instance, in policy context, but I'm not sure it's applicable in the claim of fact that's being presented, because your facts might very well be true, but they do not necessarily minimize the claims presented by the advocate. For instance, on your third point, it affects the state of mind, or on the first point, there's it's addictive. Both of those things might be true, but it could still have significant medical impact. The second point is the one where there is some attempt to make at least claims that are mutually exclusive with the claims of the advocate, but the only thing that you really talk about here is that there are alternatives that are available. Morphine you mentioned as an example, and your primary argument seems to be that it's about pain suppression, and I'm not sure that the advocate's arguments were just about pain-related issues. Does morphine have the same effects, for instance, on some of the potential patients that morphine would have? I think there's a lot of equivocation going on in that argument. You were well organized for the argument you presented, but it's not particularly responsive to the claims that the advocate presented, and so I think it's a little problematic there. All right, thank you.